Hello and welcome to Health Psychology, a biopsychosocial review of obesity by Amanda Gannon. For the introduction, we're going to discuss today obesity among the average person and how it's on the rise. Some of the causes of obesity, the psychological effects that could occur while you're obese, relation between gender and obesity. We're going to talk about ways to live a healthy lifestyle, healthcare providers that prescribe medication to help with weight loss, and there's even suggestions for over-the-counter medications. Some of our main causes of obesity, of course, is diet and exercise, or lack of exercise. Unfortunately, today's day and age, people are exercising less. They're driving instead of walking. They're not getting out of the house as much. There's this invention of mobile electronics, such as video games and TVs. Children aren't playing outside as much because they would rather play the video games. They're in a sedentary position. Then there's fast food. Fast food is very convenient for people. Instead of making a healthy home-cooked meal, you can drive right to the drive-thru. Or, cook a prepackaged meal in the microwave. All of those are filled with preservatives. They're not healthy. We have genetic inheritance. It is said that you're most likely going to be obese based on your family. If your parents are obese, you may be obese. Smoking cessation, that basically, if you stop smoking and you go through a smoking cessation program, you're more than likely going to gain weight. Unfortunately, it's that you stop smoking a cigarette, you're not putting that cigarette up to your mouth, so you have that fixation of putting something up to your mouth you're going to eat. You're going to occupy yourself not thinking about smoking. A person's sleep patterns can also affect, or some of the main causes of obesity. You have sleep apnea, you're having trouble breathing, you need a CPAP machine. Most people don't realize that when you're obese, you're snoring a lot, you can't breathe, your airway's blocked. Those are some of the main causes of obesity and sleep pattern. Stress kind of explains itself. You could be a stress eater. If you're stressed out or aggravated, you occupy yourself by eating. And you could eat, and you're not eating healthy, you're eating fast food or bad food for that fact. Psychological and health effects of obesity. Unfortunately, depression is highly correlated with obesity. Anxiety and depression in an obese person, it gives them that low self-esteem, that suicide attempt, that mental health issue. They don't realize that, they could be being bullied. If you're being bullied, then you're going to get low self-esteem because you're obese. You're going to have that suicide thought. Women with obesity are more likely to have mental health disorder compared to men. Because female weight gain is also linked to hormones and physical inactivity. So they're going to have that mental health issue over men because men are more prevalent to physical activity. Continuing health psychology and effects of obesity. Mental health distress affects the risk of obesity through behaviors. You're binge eating, you're consuming high calorie foods, you're not doing any exercises. Those are some of the factors. Unfortunately, there's a chance that a person's BMI increases, so will their depression level. A minority or low-income person, that plays a role in the treatment of both mental health and obesity because they may not be able to afford or know where to go to get the help. There's many diseases linked to obesity and overweight adults. Eating a high-calorie diet definitely affects your cholesterol and heart disease. If you're eating fatty foods, you don't realize that you're clogging those arteries, you're raising your cholesterol levels. And an obese patient with diabetes, they're at high risk of having cardiovascular disease or becoming insulin dependent. There's ways to help not being insulin dependent by exercising and diet. You could lose that weight and possibly not be diabetic. And then patients with diabetes profit from exercise, like I just said. If you're an insulin dependent person, you want to make sure that you exercise and lose that weight so you're not going to be insulin dependent. Then there's sleep apnea. A healthy lifestyle. You definitely want to live a healthy lifestyle when you're obese in order to lose the weight. It should start with education, and most importantly, educating our children about diet and obesity. Adding recess back to their day, letting them go out and play for a little bit, get all that energy out, since they're in a sedentary position in classrooms all day. A healthier food option, such as fruits, vegetables, no carbonated soda or carbonated sugary beverages, no junk food, things like that will help children who are obese. Behavioral weight loss intervention is basically behavioral therapy that involves changing your diet, having a physical activity plan, an exercise plan, changing your habits to promote that weight loss. And then, of course, you want to set your goals. Self-monitoring involves writing your goals down, writing everything you do down so you can see your patterns. Things like that help with a healthy lifestyle. Dietary changes. You definitely want to eat more fruits and vegetables. You want to eat low-carb diets. You want to make sure you're eating healthy, you're eating right. Count those calories. And if you have no time in the world to actually cook a meal, there are meal replacements that have a fixed amount of food with a known calorie content, such as Slim Fast or Lean Cuisine. You want to get out there and have physical activity. Going to the gym, walking places that are close by instead of driving, getting the family out, do a family-orientated physical outing, like biking or playing catch or playing baseball, playing sport, hiking, going for a walk in the park, things like that will help with a physical activity of a healthy lifestyle. Again, healthy lifestyle continued. There's support groups such as Weight Watchers. Those people are people that are as obese as, everybody. All those people are obese. They want the help. They want to talk about their problems. They want to get over that hump to a healthier lifestyle. In low-income areas, you definitely want to offer free groups. Even offering free healthy option foods or coupons to discount the healthy food. Anything that could help a low-income area live a healthy lifestyle. There's diabetes prevention programs where you meet with a nutritionist, you meet with a primary care physician, you have a community group setting, you do all those things as effectiveness in helping participants. That you're with people like you, so it'll help you. And then you want to decrease the number of unhealthy behaviors, like get the TV and turn it off. Get out of that sedentary position, walk around, exercise. I can't stress that enough. Keeping unhealthy food choices out of the house. Adding more fruits and vegetables, again. Adding a healthier, low-calorie diet. Talking to a therapist helps with your problems. If you're having an issue with obesity and a mental health issue, go see a therapist. They'll help you with both issues. One does not perceive themselves as being overweight. You can't help yourself if you don't know you have that problem. So if you don't see yourself as overweight, then you're not going to be motivated to lose that weight. You're going to think, well, I'm not fat or I'm not obese. The pharmacotherapy of obesity, there's 5 medications right now for a chronic weight condition. We have phentermine, which was approved in 1959, which is a weight loss. It controls weight loss. There's Ally, which is orlistat, phentermine and topiramate, naltrexone and bupropion, and liraglutide. Those all will help you with weight management. And the specific medications that I mentioned, phentermine is an amphetamine-like prescription. It's used to suppress the appetite. Weight loss can be gained back if the medication is beyond a year, or if you stop it, you can regain that weight back. There's different surgical treatments available. 3 of the most popular right now is bariatric surgery, which is also known as gastric bypass, the lap band, and the gastric sleeve. Over 20,000 surgeries were performed in 1996. Now, as of 2003, it's increased to more than 100,000. Unfortunately, having gastric bypass could lead to issues. You are forced to change your diet and your exercise behavior. There has been reports that people feel more comfortable and confident after that surgery, that they're ready to go out and feel attractive and show off their skinny body. The lap band is another one, approved in 2001 by the FDA. This particular procedure is reversible. It is just a band that is slipped over your intestines, and it actually lets you absorb only so much of the food content and fat that you eat. It is one of the most common procedures. However, there are a lot of complications to this procedure. The lap band could slip, it could break. People have overeaten and it stopped working. Things like that. Sometimes, because it is reversible, it can be removed. The gastric sleeve is another one. This takes months to heal. This is a little more complicated. And it also has complications of leakage from the gastric staple line. It also can slip while it's in your system also. Socioeconomic status and gender relation. Unfortunately, the higher obesity level rates in youth is with African Americans and Hispanics over whites. Our lower income neighborhoods have more fast food restaurants and convenience stores than our wealthier areas. Also, there's no safe exercise environment in a low income community, or programs at that matter. So basically, they need to work on getting the lower income families a better community system to make it safe for them to exercise. The low obesity prevalence among white girls and American girls, and unfortunately puberty plays a factor in youth obesity because of that hormonal change. A default lifestyle. The industrial production of food products provide an excess of cheap calories always ready at hand. Like I said before, people are driving to those fast food restaurants. They're eating fast food, they're eating processed food, which means that they're going to be not eating healthy and becoming obese. And most individuals don't understand the dangers of that default lifestyle. They don't realize that they're actually hurting themselves more by resulting to that lifestyle, by making it easier for them to eat that stuff instead of cooking. A lot of individuals are busy workers. You work 8 hours a day, you don't want to come home and cook. So you go to that default lifestyle and you eat the cheap high calorie meals that are readily for you. It's really not a good lifestyle to live. And here are my references to my paper.